I'm Dr. Ben Newman, and I'm a coronavirus researcher. Not a statistician, and it would really help if I was for this particular one. So, somewhere in the comments, Nicola told me there was somebody asking a question about how do we actually know that Omicron is or isn't more severe, and basing it on, personal assessment that it actually may be less severe. So let me try and answer with the answer to where I'm coming from and what I'm looking at here, because it's probably different than some people are looking at. So, right off, let's start with this. So, this is from the CDC and Omicron, blah, 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 blah. What do we know about it? So they say a couple things that are actually supported by facts that are reasonably well attested, and they say a couple of things that are not, and they do not differentiate them, and they do not cite sources. So this is one of those rare cases of I don't know. I think they're trying to make it digestible to the general public, but these are red flags for me. These are things that I don't know that you can take fully without a grain of salt. So spreads more easily than the original virus, um, which that's the case. And you can spread it even if you don't have symptoms. I have not seen a study that specifically demonstrates that, but it's true for all the other variants. And there have been big studies with previous variants, so probably that's accurate, but it's not specifically accurate because I don't think they have particularly robust data behind that statement. Persons with Omicron can prevent with symptoms from previous variants. This would be the basic assumption, and this appears to be backed up by a reasonable amount of data, and we'll get into the data. These are on the next couple of pages we're going to go through. Severity can be affected by vaccination status, probably, and there are smaller studies showing this, but they're not amazing. Presence of other health conditions, age, and history of prior infection. So there, I think once again they're drawing more on prior data with bigger data sets. The data for Omicron specifically are still rather small and a little tenuous. Here we get into the controversial part, but it is not marked with little blinking red letters. Omicron generally causes less severe disease than infection with prior variants. That I don't believe that is substantiated. So let's go through this, because I think this is part of the problem when you have the main group that is supposed to be putting out COVID information, and they're putting out things that seem like they could be true or are based on, I think in this case, studies with some big flaws. Then I think you can end up basically trying to do the right thing and end up getting to the wrong answer, essentially. Yeah. So, bad study design, bad results, bad conclusion. And if you use the bad conclusion without looking at the design of the results, that's you're not doing your job. Yeah, basically. All right. So, yeah. And all this we're going to talk about, this is gray area stuff. This is stuff that is not fully pinned down. And you can say, I've got an opinion on this, or I heard somebody else had an opinion on this. Right now, nobody's opinion is fully informed. That's what I'm going to say. And as a scientist, you have to be skeptical about these things until convinced by overwhelming data. It's not this sort of knee-jerk skepticism where you only disbelieve things that go against something else, that's unrelated to science. It's got to be genuine. You've got to line up the facts, and if they do not pass muster, you're not allowed to believe a thing. That's the job. It's an annoying part of the job, because sometimes you can look at something and say, I bet that's true, but yeah, if the numbers are not there, no, can't do it. All right, fine. Let's go over here. So this is from the European CDC. So this is from a couple of weeks ago, about 2.5 weeks ago. And this is the key line there. There is still limited evidence suggesting that the observed severity of Omicron is less than that observed with Delta. And I think that is an honest statement. Now, the European CDC came out a week later with an explainer that looks just like the current CDC explainer on Omicron, where they get rid of this statement, which this statement is accurate. And there was no giant new study added to the pile of data during this time that I'm aware of that would indicate that it is definitely less dangerous. All right, so this is where we are. You've got, CDCs in Europe and the US saying potentially opposite things, or at least in this one particular briefing, we're putting the correct caveat on here, which is that we still have limited evidence. And limited evidence means you can't just assume something. You gotta have nice, strong evidence, and you gotta have the statistical analysis to back it up. And in general, more sophisticated statistical analysis that takes account of more variables is to be very much preferred, and is just going to give you a more reliable result than a statistical analysis that is simpler but leaves things out. Well, that's just, my limited understanding of stats right there. Okay, so jump over here. This is a paper that came out, I think, 2 days ago, and it's not even a paper. It's like a letter to the editor, basically, a perspective. And you know what? These two, Bhattacharya and Hanage, I'm probably mispronouncing that. I feel like they're right. So what they're saying here is that it is challenging to infer the intrinsic severity of Omicron. Why? Because of this. So, well, my computer's super slow, but here, can we make it bigger? No, apparently not. What it's saying is that if you are comparing historical data to modern data, or even current data for two different variants, there is a difference. And the difference actually comes from the next paper, which is called Report 49, which is, I think, the biggest one, and I still think it's the best one that's there. Eventually, it will be supplanted, but it hasn't been yet as far as I can tell. What they say is that Omicron is more likely to break through pre-existing immunity. And we have lots of papers saying that pre-existing immunity gives you some protection against hospitalization. So if most of the people infected by Delta here, that's what the little red people are unvaccinated, and only a few are vaccinated because it rarely breaks through vaccine protection or previous exposure protection, then basically if you're infected, you are bearing the full weight of the virus and bad things will happen at a higher rate. With Omicron, it is going to specifically get through a lot of pre-existing immunity because it's different on the part where neutralizing antibodies would bind. So particular antibodies that prevent you from getting infected and are generally pretty helpful along the way. And so your sample size is going to have a lot more people in it who have some immunity. And having some immunity still does protect you against severe disease to some extent. It's not a yes/no kind of thing. It's some extent. Here, let's jump to this tab over here, and let's move it over. There we go. So this is where we are roughly in terms of cases and whatever. So let's jump off of deaths for a minute, if it'll let us. No, apparently not. Yeah, it looks like I need to restart. Anyway, what we see here, if we were able to look at the other page, is that at least in the U.S., we have about, I think it's, we sort of peaked at somewhere between 800,000 and 1 million cases a day, which, think about that. That's a lot in this peak. And if you're comparing it to last year, the peak was it's kind of an average of 200,000 a day with little spikes up to 250,000 a day or so. So about 4 times more people got infected this Christmas compared to last Christmas, which is bad. But look at the death rates. So a lot of the infections over this particular holiday season, Christmas, January, New Year, February, a lot of these are Omicron now, more than half, and in some places, nearly all of them. And you can see that we're basically, in terms of deaths, right around the same level as we were last year. And last year was the worst on record. Thing is, last year, around this time, few, if any, people had a vaccine. So there was essentially no immunity. So based on this, okay, 4 times as many people infected per death versus, last year, you could say that, okay, you get about, whatever, 75% protection, something like that, ballpark, against death, if you have some sort of prior immunity. So we'll assume for this that everybody is either vaccinated or has had COVID by this point, which is, again, not completely true, but it's closer to true than it is to false. Yeah. And this is back of the envelope. This would not pass muster in any journal. But I'm just, these are the basic things we're working with here. All right, so let's shut that. And so, yeah, challenging because the Omicron variant infects a different set of people. You're always trying to compare people in a hospital with one strain versus people in a hospital with another strain, or people in general with one strain versus another strain, but they are not infecting the same people, because people are unlikely to be infected by Delta if they have some degree of immunity, which most people have in America and in Europe by this point. Other parts of the world, that is not the case. Yeah. Versus, you may even have a majority of people who are infected with Omicron that still have some sort of immunity. And so it would look milder because of this. And unless your statistical analysis is taking prior immunity, like, presence of T cells or antibody producing cells into account, it is not a fair analysis. Okay, so a group has kind of attempted to do this, and it's got the biggest data set, and so this is the one that I'm going with still. So this is there we go. This is report 49. All right. And report 49 out of Imperial University in the UK is very nice, and we're going to jump down here to this. So they used a thing called a Poisson regression, if you're into your stats. Poisson regression and logistic regression are the two major techniques that people are using to analyze these. There are situations where one is going to be better than another, but you kind of have to see the whole data set, or they have to tell you about the parameters of their data in a way that you can understand in order to know whether or not one is more appropriate than the other in a particular situation. So we are relying to some extent on the statisticians being good at their jobs here, and hopefully they are. Yeah. And I still think this one's the best paper out there because it's got the most people in it. Flip a coin 5 times, you may come to the conclusion that a coin comes up heads 4 times out of 5. Yeah, amazing. Publish that in Science. Yeah. Flip it 100 times, you're less likely to come to that conclusion. Flip it 1,000,000,000 billion times, and I'm pretty sure you're not going to come to that conclusion unless there is something fundamentally different about the coin, the gravity, or the way you are flipping it than I would normally have experienced in my lifetime. So here you got 208,000 people with what is probably Delta, and you got about 15,000 people with what is probably Omicron. Now they're basing this on, it's called S gene dropout. So they do a test, and if there's a deletion in the spike, which you do get with Omicron and you don't get with Delta, and if they're doing this at a time where the careful sequencing shows that they had a mix of mostly Delta and some Omicron and very little of anything else, it's a reasonable proxy for the couple of weeks in which they collected this data, and is a proxy that no longer would work because now we have BA2, which is Omicron-like, and so it would break through infection, but which does not cause S gene dropout. So there you go. Anyway, what we're looking at here are odds ratios. That's where our little OR is. So like, what are the odds of this particular thing happening if you have the Omicron with the spike dropout versus the Delta with no spike gene dropout? And so, blah, 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 we don't really care about place. So that's just looking at the spread of it in different places. Here we go. This is a good one. Symptoms. So what are your odds of being symptomatic? Well, they're 1, which means you have exactly the same odds of getting symptoms if you have Omicron versus Delta. And this is not a study of 200 people. This is a study of, 220,000, 225,000 people. So it's a bigger, better, more robust study. It still has problems, but it's the best one still. This is the champ. It will eventually be replaced by something better, I hope, because it would be nice to have a real answer to these questions. The odds of remaining asymptomatic are also right about even. Yeah, so no difference. Omicron versus not Omicron. Let's see, the odds, different ethnic groups. This is more reflecting what's going on in the UK in particular, and which communities happen to get it first. And you're looking at differences that are social differences and related to all kinds of things that really don't have much to do with the virus. They're more cultural, human, things. Reinfection status, here we go. So if it's not reinfection, there wasn't really a difference in whether it could infect, because if you don't, it's a COVID, it'll infect. But if you already had immunity, the odds of reinfection were about 6.5 times higher if it was the Omicron variant. So Omicron breaks through 6 cases, when for every one that Delta would break through, something like that. So it is just more primed for breakthrough, which gets back to the other thing, where it's actually infecting a different population of people, many of whom have pre-existing immunity. So the whole thing about being milder or more severe is very much confounded by that, and they can't account for it further in this particular one. They'll go on and look at vaccine efficacy, and vaccine efficacy is not great for any of the vaccines versus Omicron. But let's jump over to, so this is the best paper. Now let's look at the 2 papers that everybody cites. So this is the first one. And the preprint came out back in December, I think. This was one of the first things we heard about Omicron. And so it was, it was looking in South Africa at people with probable Omicron. I believe they were also basing this on S gene dropout, although I don't remember that for sure. The problem with this paper, they actually stated in there, which is a good, honest thing to do. It's not in the headline. It's not in the abstract. It's not in the parts that people that don't dive into this thing would read, but it is there. So I guess people are going based on the headline, and they're leaving out the caveat, which is that data on vaccination status and comorbidities were only available for people who were hospitalized. And so they were looking at all the people that tested positive and whether or not they got into hospital. And so basically, therefore, we could not control for these variables in the analysis. So they couldn't do anything related to vaccine status, comorbidities, and they don't even mention prior infection status, which apparently probably they didn't test for. And you'd say, well, why? Why would a hospital not test to see whether you have antibodies? And the answer is it's probably not directly relevant to, standard of care, to like giving the people the best treatment possible. It's more like a question that would be useful to know the answer to scientifically, and also somewhat expensive. You'd have to run a couple dollar antibody test looking for nuclear protein antibodies. That's a good way to tell if somebody was previously infected. Generally, people would know if they're previously vaccinated. They have a little card that they can carry around. But that's like a direct test that can show if you were previously infected, because a lot of people don't know for sure, or they think they were, they think they weren't, and oftentimes you can't tell. If it's asymptomatic, you can't tell. All right, so this one came to the conclusion that, and they use logistic regression, which is, I think, fine, but again, we can't see the actual data in the detail we would need in order to make that assumption. But they conclude that Omicron is less dangerous, but they weren't able to compare to control for any prior immunity. So it runs into the problem right there, that if Omicron is infecting a different population, which they did not know at the time that they put out this preprint, then there's no way they could build that into their calculations. So this is the one that gets cited the most because it was the first thing out. It's one of these first to market things, like the first idea dominates a marketplace. And yeah, this one's really dominating, but it's got flaws you could drive a dump truck through. It's if I knew how to drive a dump truck. Here's another more recent study. This one's coming out of Houston, and this one comes to a similar conclusion, has the same flaw in terms of not knowing whether people are in the same population and or have prior immunity. So it was an attempt to get a handle on this thing early. And I think you'll see the more careful controlled studies start to come out maybe in a couple of months as people are collecting their data right now and doing all the tests to make sure they know what's going on. Interesting thing from this one is that, here we go, median PCR cycle threshold. So this is a number, and the lower the number, it means the more virus the person had on their sample. And what they show is that we got 20 for Omicron. You got to jump up here to see. There we go. There's the Omicron, and then we got Delta over here. So this one actually shows that there is more virus, about 2 times as much, in people who have Omicron. And you can say, so what? Who cares? And you can also say, well, that's only a total of, about 7,000, 8,000 people? About 7,000 people, involved. So it could be a bigger sample size for sure. But they're working with what they have, and I'm glad that they published, because now we can actually look at this data and talk about it, and otherwise there's just speculation. There's nothing else. So why do we care about the amount of virus? Well, so I pulled this from a paper which is reviewing, and it's actually using a lot of these articles. So it's looking for the correlation between SARS viral load and transmissibility, and SARS viral load and severity. And they find correlations with both. So if there's more virus in you, you're more likely to spread it. And I think on a basic level, that at least passed the, does it make sense test. Seems logical, fine. And also, if you have more virus inside you, it tends to be more severe. So here are some of the papers, and these will actually have other papers inside them, like little Russian dolls. And so there we go. 4 of these 5 show or come independently to the conclusion that more virus is correlated with higher symptoms, higher likelihood of being hospitalized, sometimes higher mortality. And the only one that doesn't is one that we can pull up here, which unfortunately only has 287 patients, and they're already in the ER. So if you had somebody who is in the ER, like viral load will determine in large part who gets to the ER. It determines your odds of getting to the ER. But once you're there, you're in a very small sample set already here. And with a sample set of that size, it is probably impossible to really control for things that we know are very important, like age. That's another thing from the Houston study. Here we go. So patients infected with Omicron were significantly younger than Alpha and Delta patients. And so what do we already know about age and COVID? The older you are, the more likelihood of severe disease, right? That's actually pretty well established. Every variant since the first one, and that appears to be a good, solid conclusion. I feel like we can rely on that. And saying importantly, as if it's a surprise, maybe to them only, Omicron patients were hospitalized significantly less frequently, but Omicron patients were significantly younger, and significantly younger people do tend to be hospitalized less frequently. With COVID, that's a thing that's been true since the beginning. So it's infecting a different population. You are seeing it in people who are younger. In a lot of those cases, it is breaking through immunity that they previously had from probably prior infection or in some cases prior vaccination. And so as a result of the difference in the way the virus works, the different group of people it's hitting, it's hard to say for sure that Omicron is less severe. And until and unless I actually see a good paper with the right statistical analysis that comes to that conclusion, it's my job not to believe it. So I know there are people with a lot of opinions, and we said this at the beginning, but those opinions are not fully informed yet because nobody's opinions are fully informed. But if the people giving the opinions haven't gone through all of this data, and in most cases they haven't, then their opinions are totally uninformed, and I don't know. That doesn't seem like anything good could come of that. So there you go. So is Omicron less severe? Jury's still out, but it doesn't look like there's any credible information that it is definitely less severe. And until and unless shown that it is definitely less severe when you're controlling for age and prior immunity and all the other things, it's not a conclusion you can rely on. So like they showed in the report 49, which is here, there we go. Omicron is COVID, and it's about as likely to do all the bad things that you get with other kinds of COVID, and it's not any milder. And I know there are a lot of people who are hoping, who are assuming that the virus will change in a way that is helpful to us. It's like they're imagining a big guiding hand that's somehow exposing us all to COVID and beating the heck out of people, but is benevolent at the same time. Or they're expecting that it's going to magically turn itself into the flu somehow. In some metaphorical sense. Obviously not in any sense that would that a virologist would not tear their hair out at hearing about. But right now the evidence is not there. And if you got people, countries, CDCs, wherever, that are saying, yep, it's less severe, it's milder, people are going to believe that. But if those are not reliable conclusions backed up by real big, well-coordinated data, then those are, frankly, somewhat dangerous conclusions. Those are not demonstrable. And when big groups and important people say things like Omicron is less severe, I suspect, I don't know, but I would suspect that it would cause other people to relax and or change behavior in a way that would lead to more cases. And like you saw with the numbers this Christmas, we're doing about as many deaths per day in the US as we had before the vaccines were available to anybody. And it's not that the vaccines don't work, it's that we're getting so many more people infected now that the cases where the virus breaks through a vaccine and still kills a person are enough that we still end up with, in the same situation. It's not hopeless. The vaccines do work, and using them more does seem to give better results. That's something that they look at down in the vaccine effectiveness section down here. But I guess that's a topic for another time. For now, just stay safe. And if somebody's telling you that Omicron is definitely less severe, and or they're basing policy decisions on that, I think they're building their house on the sand, as they used to say in the Bible school song. I think the next storm could wash them completely away. It's not a stable foundation. So there you go. That's a look at kind of inside the numbers and how a thing can appear to be one way, but actually maybe not if you get into it properly. And so that's where we are right now. Yeah, the ideas have got very far out in front of facts and reality. And honestly, that is not good. That is not how science should work. It's fine if we're talking about music albums or culture or whatever else, but when we're handling scientific topics, the best way to do it is scientifically, as far as, possible, right? Yeah, I mean, makes sense. All right. Thanks very much. This has been a far too long Ask Dr. Ben.